44-year-old woman with severe aortic regurgitation. And let me now go again to the study of this patient. Before I show you the meltdown, this is the first study that we performed in her in 2008. What she had was severe aortic regurgitation. So again, you see another patient with an aortic valve problem. Severe aortic regurgitation, broad jet, hyperdynamic left ventricle, dilated aorta. Here you see the volume overload of the left ventricle. The patient was symptomatic, and so for us, it was quite clear that she needed an aortic valve replacement. Now, the reason for regurgitation was that she had endocarditis many, many years ago. Here you can see there's a tricuspid valve. You see 3 leaflets, and the edges of the leaflets are markedly thickened. So I hope you can appreciate that here. And because of progressive aortic regurgitation, she was then operated, I think it was 4 or 5 years after she had the endocarditis. So she was not operated with endocarditis, but in the chronic or the post-endocarditis state. The next study, which we performed now on the 25th of July, so fairly recently, she came in with fever. Okay, so very similar to the other patient. She had an aortic valve replacement, and she came in with fever. And this is her study. Okay. Now, if you don't recognize that, well, then you should recognize it, or you should maybe check out our course, because this is a finding which must be obvious to all of you. You can see that there is a very abnormal motion of the prostatic valve. You can see that it is moving to and fro, and that there seems to be here a detachment of the valve right here. So when we use the color Doppler, it's clear that there is aortic regurgitation which originates exactly in this region where the valve is detached. Now, what we see here is a so-called rocking motion of a prostatic valve, and a rocking motion of the prostatic valve is always a very, very important or significant finding, because it means that a large portion of the aortic valve prosthesis is detached. You can have small holes somewhere around the aortic valve and paravalvular leaks, but the valve will still be fixed in the aorta, and it will not make such a distinct rocking motion. But if it makes such a rocking motion, there's a risk that sooner or later the aortic valve will simply fall out of the aortic root. And obviously, the patients will then not make it, and you can see that there is already significant aortic regurgitation. This is the deceleration time over the aortic valve, showing you that, let me just go here, that there's a very steep curve. You can see deceleration time is 83 milliseconds, which means that aortic regurgitation, no question, is severe. And if you look at the size of the left ventricle, it's huge. It is absolutely huge, especially considering that everything was normal already after the aortic valve replacement she had in 2008. So this is a clear-cut indication to bring the patient to aortic valve replacement. And that's what we did. It's a young patient. We just had to do something quick. And she was operated quickly. And this is now the study of the patient after operation. Nothing very spectacular. All you see is a normal functioning aortic valve. But what you nicely see is how small the left ventricle got within just such a short time. This is maybe a week after the operation, or 1.5 weeks after the operation. Ventricular size has now come back to normal, even though function is not completely normal yet. And there's abnormal motion because she has a bundle branch block and so forth and so on. But putting everything together, this patient had a rocking motion of the aortic valve because she had dehiscence of the aortic valve. And the question now is, why does she have dehiscence? And let me go back to the slides. Well, as already mentioned, if you have this rocking motion, it usually means that there is a major partial dehiscence of the prosthesis, and it is usually associated with severe regurgitation, although not always. There are some cases in the literature with only mild regurgitation. Somehow the valve functions like a valve itself. But the reason most likely is endocarditis and annular abscess. And going back to the history of the patient, she told us that she had infection a few weeks previously, and that must have been the cause for the dehiscence and for the rocking motion of the aortic valve. So a very short case just to demonstrate you something that I just found I had to show to you because it was so spectacular.